Good morning. I just want to introduce Dr. Ruizhi Zheng, who is from the Shanghai Jiao University School of Medicine. And he and his colleagues have been conducting some research on the effect of outdoor light at night on the incidence of diabetes. So, Dr. Zheng, I'd like to just talk to you a little bit about the background to your study. So what sorts of research had already been done on light at night and diabetes, and what interested you in taking it further to look at effect of outdoor light at night on diabetes?
Thank you for your question. My research focuses on risk factors and management of diabetes. As you know, the prevalence of diabetes in China has continuously increased during the past decades. Therefore, the discovery of novel risk factors of diabetes can help the prevention of the disease. To assess the light and night, or we can also call it LAN for short, LAN exposure on diabetes have implications for those living in modern societies, because currently indoor and outdoor light exposure is common at night. In animal models, LAN exposure damages the circadian rhythm and induces the glucose intolerance, increase the blood glucose and insulin levels. In human studies, LAN exposure was also positively associated with obesity and blood pressure levels. As for diabetes, if a causal relationship between LAN exposure and the diabetes can be established, interventions can be delivered to reduce such exposure in order to prevent diabetes. Thank you.
Thank you. So, as I understand it, then your study is moving this work on LAN a little bit further by looking at outdoor LAN as opposed to indoor LAN and how that affects diabetes. And you had a large cohort of participants for this study, the China Non-Communicable Disease Surveillance Study, which had a large number of participants, over 98,000, I believe. So could you tell me a little bit about this cohort and who the participants were and what parts of China they come from?
Yeah. The China Non-Communicable Disease Surveillance Study was conducted by collaboration between China CDC and Ruizhi Hospital. It was conducted based on the China CDC's National Disease Surveillance Point System. This system had 162 study sites and was designed to select a nationally representative sample of the general population in China. The study site was either a district in a city or a county in a rural area. At each site, a complex sampling design was used to select adults who had been living in their current residence for at least 6 months. As for artificial outdoor land, it was retrieved from the U.S. Defense Meteorological Satellite Program. The average radiance of the outdoor land for each study site was calculated, so the participants living within each study site were assigned the same radiance of the outdoor land. Thank you.
Thank you. And so you did some very interesting work then looking at these participants living in different parts of China, some in a very urban settings and some in very rural settings with different kinds of light pollution. What were your main findings from the study? What kind of differences did you see in the different populations?
Yeah, we found significant associations between chronic exposure to higher intensity of outdoor land and increased risk of impaired glucose homeostasis and diabetes prevalence. Also, the highest quintile of LAN exposure was associated with a relative increase of 28% in the prevalence of diabetes than in the lowest quintile areas. We were initially a bit surprised by the large increase in the risk because we considered the effects of artificial land would be relatively small compared with the risk such as obesity.
28% is quite a high risk, isn't it? That's quite a big difference, the 28% that you found.
Yeah. 28%. Yeah. But considering that the chronic exposure of artificial land can be years or even decades, and the exposure in the highest quintile of light exposure was almost 70 times higher than the exposure in the lowest quintile. It might not be surprising after all.
That's a big difference, isn't it? So thank you. Yes, and so what are you hoping to do? Do you want to continue this research further? And what kind of additional research would you hope to do?
Yeah, I will continue this kind of research because the current study uses the data from a cross-sectional survey. We plan to validate the association and evaluate the impact of land exposure on other cardiometabolic health factors when prospective data are available. We also plan to investigate the effects of other environmental factors on diabetes incidence, such as air pollution and climate factors. Thank you.
That sounds interesting. And would that also be using partly the same cohort when you're looking at other environmental factors? You'd still be the China non-communicable disease surveillance survey data. That's very interesting. And in the meantime, do you have some advice both for national levels at a public health level or for us as individuals about how we can decrease our exposure to light at night or how we can mitigate this potential problem?
Yeah, based on our findings, we have some suggestions. For individuals, we suggest avoiding outdoor and indoor light exposure at night as much as possible, and keep a dark environment during the sleep time. Another way, for public health, we suggest reducing the luminance of advertisement screens and other light sources at night in the residential area to reduce the potential harm of light exposure on health. Thank you.
Thank you. Well, thank you very much, Dr. Zhang, and it's very interesting to speak to you. Thank you for joining us today, and very good wishes, best wishes for your future research. Thank you.
Thank you.